Tom Griffin,
Here.
Joe Deere,
Aye.
Pam Duncan,
Aye.
Rex Gordon, Gerald Legg,
Here.
Wes Hart, George Haskowski,
Here.
Mike Shambaugh,
Here.
Joe Smith,
Here.
Denise Taylor,
Here.
Victoria Duckworth. We have one.
Thank you, thank you. Has everybody had a chance to look at the minutes? Could I get a motion to approve?
Motion. Second.
All approved? Aye. Aye, opposed, same thing. Okay, reports. Let's go with Claremore Service Unit. George Valeur.
Hey, good afternoon.
Hey, George.
Good morning, George. How are you doing?
I'm doing well, thank you.
Well, good.
This morning, this morning we had 5 inpatients, 1 with COVID, nobody in ICU, nobody on a vent, and no PUIs.
Wow.
Today, through Friday, we have given 12,738 vaccinations. Our testing has dropped off significantly. The last week we've done less than 10 a day on our drive-through testing facility. Our infusions have dropped off to almost 0, and I think the rest of that is in my report. Are there any questions? That's the big hot topic, is vaccinations.
Anybody?
Madam Chair,
Yes,
let's
sir.
give this Claremore Service Unit an applause. I mean, nobody on vent and nobody in ICU.
Isn't that a blessing?
Wow.
Thank you.
That is truly a blessing, George. Congratulations to your staff.
Oh, thank you.
Anyone have any questions? Counselor Buzzard?
Yes, George, on the renovation there, are you completed?
No, sir. We're taking down some things that we had put up for the when we were getting hit by the surge of COVID. We're taking down some of the temporary walls and doors today as we speak. But we're continually, things are shifting. Is there any particular thing that you're interested in?
No, I would just by there and saw that you did some of the work, and it really looks nice, especially back there in the emergency area.
Oh, yeah. I think for now we're the emergencies area is done. We've moved on to a couple other things, and maybe we've got another phase in the ER, but that'll be a few years down the road.
Okay. I had another question for you.
Yes, sir.
In your area, if you have local schools that have children that has psychological problems, do they come to the hospital there, or how is that handled up in the Claremore area?
I believe they can. That would be under our behavioral health office, and that's one of the nation's programs, sir.
Okay, because I know
I don't handle that program.
Okay, I know with the DHS program that it seems to be a lot of kids fall by the wayside, and they don't get the attention that they need. So I didn't know if you handle any of that in the hospital or not. So.
No, we don't on our side. No, sir.
Okay, all right. Okay, thank you.
Yes, sir.
Anyone else with any questions?
I have one.
Yes.
Hey,
speak about-
George, in your hospital, do you have the mandate to wear a mask?
Yes, sir.
Okay. All right. Thank you, sir. Good.
Yeah.
George, I have one. Are you using your the people in your dental division to do the COVID testing and COVID vaccines?
They were, yes.
Well, I was just noticing because you're almost 65% down in the dental clinics. So I didn't know if you
We
had-
are. Yes, ma'am. I'm sorry. Yes, we are. We have been. We have some new hires that are actually going through new employee orientation. They started today. We have 9, and they're all LPNs designed to take over the testing so that we can get our dental folks back in dental, doing dental work, and freeing up some of the surgery nurses from giving vaccines to get back to getting in the operating room.
Very good, very good. Well, listen, I sure appreciate your report today, and thank you so much. It sounds like, you're all doing an excellent job up there.
Oh, well, thank you, ma'am.
Thank you, George. Appreciate you.
Uh-huh.
I'm sorry? Oh, I'm sorry, Counselor Austin.
George, what's your current phase as far as vaccinations?
We are pretty much open to everybody, sir.
And that's Indian and non-Indian, correct?
That's correct. We've given out vaccines. Our appointments started to trickle down to next to nothing, so we opened it up, and we've opened it up to people here in the community.
Thank you, George.
Yes, sir.
Yes, Counselor Buzzard.
George, have you got the new vaccine that, I think it was Johnson that came out, the single dose?
No, sir, we don't have that one yet.
Have you heard or have you had any discussions about how it affects Native American?
I have not heard or been involved in any discussions with that one yet, sir.
Okay, someone shared a link with me that discussed that about the vaccine and how it affected or it had some complications for Native Americans. So maybe I can send you that link.
I would appreciate that. Thank you.
Okay, I will. Thanks.
Anyone else? Okay. Well, George, you have a blessed day, and thank you so much for your report.
Thank you.
Okay. Next up is Dr. Steve Jones. Hello, Dr. Jones. Are you with us?
Can you hear me okay?
Yeah, now we can.
Okay, great. They gave me this headset because they said you guys couldn't hear me very well and I couldn't hear your questions very well. So maybe this will make it a little better this time.
It does.
So does it sound better?
Much better.
Great. All right. So the report is in your packet. I'm not going to spend a whole lot of time on the report because we tend to go over the same things every time. I will point out the approval rate on the contract health continues to be high at 96 or 96.9%. So we kind of stay between 96% and 100% or 99% on every month. So other than that, I want to kind of go over some things that are going on within our department that is pretty exciting. We just signed an agreement and started to expand our service line there at Hastings to have cardiology available 24/7.
Yay.
So that's
excellent news.
That's going to help us keep patients closer to home and not have to transfer patients out as often as we have in the past. That's one of the things that we look at as our expenditures and contract health, and we've been trying to work on this for quite some time, and we've been able to achieve that recently. So with that, we have stroke and cardiology available to our patients at Hastings now. So that's been something we've been working on, and I'm glad to see that come to fruition. Next thing I want to talk about is our dental and optometry. I know I've gotten several questions from several of you on when we were going to get back open. They are working at 50% of their normal schedule currently, and by the end of the month we're looking at 75% of their capacity as we roll back some of the testing locations and our hours on testing to allow our folks to get back to the dental clinic and to optometry. Testing has fallen off quite a bit, dramatically actually. Our positive test rate has fallen down to a little below 2%, which is fantastic. It fell off quite a bit to 4%, and then now the last 2 weeks we've been holding steady at right around 2%. So that's been a welcome sight. It is still available at all of our locations. Most of our rural locations, we're doing testing in the morning, but if someone comes in the afternoon, they can come in the building and get tested. So it's still available, and we are doing the rapid Abbott test for patients out in our clinics. As I said, we're doing that in the mornings because in the afternoons we've started our vaccine clinics at all of our locations. So we'll talk about that just a little bit here. So vaccine clinics are running at all of our clinics, all of our locations now. In our rural areas, they're running in the afternoons, and at Bonita, Muskogee, Tahlequah, and Salisaw, they're running all day. On Thursdays, we're giving extended hours till 7 o'clock, and then we are working on a couple of events off-site. We're not ready to announce those just yet. We're still working through the logistics of being able to offer it, and then we're going to offer those vaccine clinics on a Saturday. So, but they will be off-site at some of our other casino locations. And then as of Friday, we have given over 33,500 vaccines. We are currently open to anyone in the 14-county reservation. And we are currently offering about 1,500 appointments a day, and we're only filling about 60% of those. So anybody that you guys can help us get the message out to, I know we've been pushing it out through communications frequently, but we're still not filling 100% of those appointments each day. So that's why we extended it into after hours to see if we could pick up people who maybe had a problem getting there during the day. And then again, that's why we're looking at doing some Saturday events to try to increase that capacity. The other thing that we're looking at, we did receive some of the Johnson & Johnson, a very small allocation of it. It is a one-shot vaccine. Our medical team is looking over all the EUA on that, making sure everything is appropriate before we administer any. We have not administered any yet. We are looking at utilizing that since it's a one-shot vaccine out in areas where we may only be able to get to someone one time, as in shut-in or homebound patients. So that's something that you guys as counselors can help us. If you can tell us what those constituents or those patients that need us to come to them. We don't want to do it for convenience, but we want to do it if someone is truly cannot get to one of our sites to get vaccinated. We're putting teams together to try to push those all into one geographic location. So once we open a vial, we don't waste the other doses in that vial. So that's something that if you can get that information back to me or to Tara Lee and so that we can start making that list and making those accommodations as quickly as we can to be able to utilize that those efforts. And then that is about the end of my report. So if there's any questions, be glad to field them.
Thank you so much, Dr. Jones. Counselor Deere.
Hey, Jones, when you were talking about the other places that you're going to open up, are we going to be pulling that staff from the clinics to staff those areas for Saturdays? And because they're on extended hours now, how are we going to try to reduce that to save some of the time? Because that seems like they'll be working almost double time doing that.
Well, we have obviously we have a really dedicated staff, and so we're making we'll make the as soon as we get all the logistics put together, we'll ask for volunteers, those that want to pick up an extra shift or work some extended hours, and we'll work our way back through there. It's not a mandatory effort at this time, and we've done this in the past where we've extended our testing into Saturdays, and we've asked for volunteers to help us with that, and we've had an overwhelming response. So I don't feel like that's going to be a problem to do the Saturday vaccine clinics. We're not going to do them infinitely. We're going to have some set days and some set times that we're going to do it and try to be there and make our time as efficient as we possibly can. So at this point, we've not had any issues staffing when we've asked for volunteers that would want to pick up an extra shift.
All right,
Okay, Counselor Crittenden.
Doctor's gonna see if you can clear something up. Once somebody, I've heard both ways, gets the vaccine, some of them are showing symptoms, and are having a rough time. Are they contagious, with those symptoms or not?
No, they're not. Whenever you get the vaccine, there's not a live virus. It creates an immune response or an inflammatory response, and that's the symptoms that they are exhibiting is that inflammatory or immune response that's created from the vaccine. Actually, that's a good thing. That means your body's working and producing those antibodies that they need to fight the virus if they should get exposed.
All right, thank you. And just kind of an update on Stillwell, if you would.
Stillwell is on track. We've had meetings weekly. We're being told that we're running right on schedule, so that's the best update I can give you at this point. I do want to say, and one thing I forgot to mention is Stillwell is the only clinic where we're doing the vaccine clinic off-site, and we're doing it at the CNI location, the old Walmart building there in Stillwell. There's a new testing and vaccine building out in front of that we're utilizing to do a drive-through vaccination effort there, just simply because we don't have the parking. We don't have the ability for traffic control at the clinic currently with the construction going on.
Thank you, Chair.
Okay, Counselor Shambaugh.
Hey, Dr. Jones. I've had a couple of phone calls from constituents who live within the counties, but their elder parents do not. They live just outside, so they're at large. Do you think at some point in time we're going to offer this to at large?
Probably. Right now we've just kind of moved through these phases and I can't say absolutely, but probably. More people are opening up. I think even the health departments are opening up their phases because they're not able to get their appointments full, is what I'm being told. So I can see that happening in the future.
Yeah.
But if you can help me, if you can get with me and give me the circumstances around it, we will work to try to get as many people vaccinated as we can.
Right. I know that we've get calls occasionally saying that so-and-so didn't show up or so-and-so wasn't showing up, and can we find somebody? We're getting these calls at my office and in the city, and, we're trying to help out that way. But gosh, you guys have done a good job of getting it to the public and our citizens, and if we could keep expanding, it would be nice if we could at some point in time look at our at-large. That would be quite an accomplishment. So thank you, sir.
Yeah, absolutely.
Counselor Buzzard.
Yeah, Dr. Jones, I had a couple of things. I had mentioned to George Value a while ago about and I don't know if there are complications or side effects from that Johnson & Johnson shot. I'd read an article about being administered to Native Americans, that it was affecting them a little bit different than the other population. Have you read that or seen anything on it?
Well, we haven't administered any yet, and like I said, we're having our health team, our Dr. Montgomery, Dr. Pomera, Dr. Gann, review those EUAs completely and make sure that everybody's comfortable with it before we start administering that vaccine. So at this time, I have not heard or Dr. Montgomery has not conveyed to me that there's any complications with it. But if there is something, we'll find it, and then they'll make the recommendation on whether or not we should utilize it.
It just seemed to me like, and I'd have to read it again, it seemed to me like the effectiveness wasn't as well as what the Pfizer or the Moderna was. So anyway, I just wondered if you'd heard about that. The other thing is, go ahead. I
can tell you that the efficacy on it is slightly lower. That's been out in the press. It's around 67%. But its effectiveness to keeping people from getting severe COVID and into the hospital is just as effective as Pfizer and Moderna both. So there is a little bit of a play on words there with the way it's portrayed, but it is a little less effective when you look at the pure efficacy of the studies that were done.
Okay. The other thing that, what do we do with school children? I'm talking young adults, not young adults, but young children that have special needs in schools, and they go to the school and they want to refer them. Do we have a special unit that takes care and talk to those kids in the nation? I know DHS, if they send them to DHS, there's so many like that they just don't get much attention, but I'm just wondering, who do they call here to the nation to have the evaluation done?
For a medical concern, what are we talking about?
No, mental or just a special needs children.
For behavioral health?
Yes.
We do have a program, a HERO program, and we do have specialized adolescent and children's behavioral health counselors within our system. So we do have programs specifically for that.
I see. Is there a special thing is there a special place to call, or that is called a hospital number and ask?
Actually, I can probably get you that information to how they get into our program, but there'll be an intake done and then an assessment made, and they'll decide, at what level and where they need to place them into our behavioral health program. But if you can remember, our HERO program is focused all on children, and that is something that's been highly successful, and we've got many accolades for that program within our behavioral health department, and that one is focused on children and adolescents.
Okay. It seemed to me like something about the HERO program, it didn't cover all the 14 county jurisdictional boundaries to me. I had referred, or I'd asked about those questions. It's been 2 or 3 years ago since I've done that, but it didn't cover a lot of our areas. Are you aware of that?
No, I'm not aware of anything like that. And
Okay.
we've got a senior director, Julie Skinner is our senior director of behavioral health, and again, I can get that information if you'll get me who you're talking about, or I can get that information out to you guys on how you can refer someone into our system.
Yeah, if you would send that to us, or send it to me especially, then I'd be interested in looking at to see that, and maybe I could call them or have this person to call them and talk to them about that too. But the other thing is mental health. I know we've talked about that a lot of times, and it's still a big thing on our radar is mental health. So I just wish we could get more involved with it and even have our own facility for that type of program. I know over in Cherokee at the Eastern Band, they have a facility next to their hospital there that, I don't know, it's probably a 40 patient bed, but anyway, I just want to keep it on the burner to make sure that we're still addressing those problems there. So if you would, send me that information for those people, and I'll have their contact number for them if you would. All right, thank you.
Yeah, absolutely.
Anyone else with any questions? Oh, Counselor No Fire.
Hey, Doctor, do we have a 1-year work experience requirement on hiring new nurse practitioners?
We do not have a work experience requirement on that. We do have a tremendous amount of nurse practitioners that are applying into our system currently. We don't have any openings that I know of currently for any mid-level positions. So it is, sometimes when you have a multitude of applications, experience plays a role in who gets hired. So, but I don't believe there is a 1-year work experience requirement on the job description.
Okay, so currently we don't have any positions open right now. We're just taking applications in case there is a position opening.
Absolutely. Anybody that reaches into our system, we get them hooked up with recruitment, keep in contact with them. If we have an opening, then recruitment will notify those individuals that they stay in contact with so that they can get an opportunity to apply for the position.
Now, are we working with the recruiters that from, I guess it'd be coming from IHS, the students that have to do their so many year payback plan working for government health facilities?
Yes, those that have payback obviously get a little bit higher priority than those that don't, and depending on which type of payback they have. If it's a directed studies payback, if obviously a Cherokee Nation payback, then those get the highest priority. Indian Health Service payback will get a higher priority when we're looking at those because they do have an obligation, and we do, all of our clinics fulfill that obligation if they work in our clinics through IHS.
Okay, all right. Yeah, I had a couple of them call, and one of them I think actually moved into the area because she had tried to apply before. I think had moved into the area, wasn't able to get hired on because, her understanding was that you had to have experience to get hired on. So now she's come due for her repayment plan to start, but she can't get hired on anywhere. So she was just curious at if there's going to be any opening positions coming available, so that way she didn't have to move outside the area, as she's a Cherokee citizen trying to repay back to Cherokee communities.
Right.
All right, thanks. Thanks.
Okay. Chief of Staff Enlow, did you need to say something?
Yeah, if I might, I'd just like to follow up on the discussion that Dr. Jones and Councilor Buzzard were having. I actually sent Councilor Buzzard the phone number for the HERO project, and I just wanted to brag on that team because not only have they done some good work over the years, it's been nationally recognized, but they actually have taken one of my kids that struggled with depression and thoughts of suicide. And so they worked with him several years ago, and he's a straight A student, and we don't spend sleepless nights wondering what's going to happen to him. So it's a good team out there, and they do focus on not only the child but the family unit as well. So they do some good work. And then to your point, that's one of the things we're hoping to address with our legislation that you guys will be voting on tonight. Public health and wellness for substance abuse treatment and allow us to kick that into high gear. So very important. Thank you. I had a question. Todd, do you know, does that cover the full 14 county area jurisdiction? Because it seemed to me like, and this has been 2 or 3 years ago, that I had a call and it didn't cover some of our areas back then anyway. I'm like
I can
Dr.
speak to that a little.
Go ahead,
I can
Dr.
speak to
Jones.
that a little bit. It was a grant in the beginning. That program was started off on a grant, and it had very specific parameters. And we've evolved that off of a grant now that it's totally our program. And so we've expanded it from that. So that's probably what your, Councilor Buzzard, that's probably what you're remembering is when it was a grant early on.
Okay, thank you. Councilor Smith?
Yes, sir. On the extended hours, I really think that's going to be, for the shot, I really think that's going to be a big hit. Is that going to start Thursday, this Thursday?
It actually started last Thursday. We made the announcements and we got the media out there and got information out. And we didn't have very much uptake on taking advantage of it. So we're hoping this Thursday that uptake will be a little more. And, as time goes by. But like I said, since we've opened it up, we've been surprised. We have about 1,500 appointments available daily. And we're only filling about 60% of those appointments each day. So we've got lots of same day, appointments lots of appointments available. And as Councilor Shambaugh said earlier, at the end of the day, if we have any doses left, we're making phone calls and trying to find someone to make sure that we use every dose out of the vial. Because once we puncture the vial to pull a dose out of it, that vial has to be used. And we're trying to not waste any doses.
Okay. Is that going to be till 7 o'clock?
Yes.
Okay. I'll try to get, because I had calls this weekend, people were asking me, and I guess we all missed that somehow, but we'll get the word out. But that's a good idea. Thank you.
Councilor Duncan?
Yes, Dr. Jones, I was just going to recognize something you said there a second ago, and that kind of struck me, is that we don't have any available positions open for mid-level providers, and also that there's a lot of applicants right now. That's something that you guys should be applauded for, because it's a lot different place than where we were at, a handful of years ago. So I thought that was just an interesting thing that you said, and applaud you guys for that.
Thank you.
Councilor Dobbins?
You're just expanding upon what Kanan just talked about, and on Wes's
situation, and Dr. Jones commented on it. Right now, the nurse practitioner field is fairly saturated. And I had to help one young lady find employment with another tribe, and she had IHS payback as well. But it's really, right now, the nurse practitioner area is quite saturated in this area. And as Kanan said, they're to be applauded for that. Normally, we're just scrambling to find somebody, but now we have this oversupply right now. It could change probably in 6 months to a year, but right now there is, you might say, an abundance of nurse practitioners. Thank you, Chair.
Thank you. Speaker Byrd.
Yes, Dr. Jones, you might get with Howard, since he has the list of the speakers that have taken the vaccine. You know, I was reading some articles on what's our next step here at Cherokee Nation. You know, we have done an outstanding job versus what other entities and agencies have done. You might look in the rural areas. If Howard has that list of speakers, you know, last count, I know we had, there were over 1,000. And, you know, we have a list of like 2,200. There's still some rural areas where we made it mobile. If we had the people that are willing to take the shot, Howard could probably, you know, get some of that, have some of those questions answered there. You know, we're talking about places like Kenwood and Oaks and Marble City and Bellefonte and some of these rural areas that we could probably complete and see what percentage of those speakers have taken their vaccination. Just food for thought there.
Yeah, and Speaker Burr, we have been working with Howard from the beginning, and we've gotten to a point now where we're starting to be a little more creative in how we, as you said, go out into the communities and get that vaccine uptake. I believe we're about at 50%, 55% of the first speakers that are vaccinated at this point in time. So, yeah, we're working with him to try to come up with more creative ideas and how we can be a little more available to meet their needs.
Okay. Thank you, Madam Chair. Thank you, Dr. Jones.
Okay, Councilor Shambaugh.
Real quick, Dr. Jones, how long can we expect these vaccinations to be effective in fighting COVID? I mean, how many? I've heard 3 months. I've heard other things. How long do these vaccinations last? Do we know?
Well, I think the research is still out on that, and you know, I listen to a lot of news just like everybody else, and you know, I listened to the CEO of Pfizer recently talking about that probably in the fall we're looking at doing a booster again. So you know, we don't know for sure. I think that's the part of the research that's not completed yet, is the longevity of the antibody, and so, you know, it's hard to answer that just at this point in time, but they are already considering, you know, the possibility of booster shots in the future. So we'll just have to see as time goes.
Okay. Thanks, sir.
Okay, Councilor No Fire.
Yeah, just one quick kind of thought. I don't know if something maybe Chief of Staff might look at too. You know, everything kind of happened real quick when we got the vaccinations. We're excited to get them, and we've got a great plan rolled out with IHS and participating with them. The only thing I could say maybe as a suggestion is, since kind of all the pandemic happened, at least I haven't received one. I know it's tough too because you do get a lot of bad addresses, but there's always someone there now who could receive it that maybe not a Cherokee citizen, but that's putting a mailer in every one of our citizens' mailbox to let them know vaccination, the numbers, the age groups, and also if you're a Cherokee speaker. You know, that was kind of the thing I thought. I know we rolled it out real quick. First it was Cherokee speakers, and we went 65, 55, and now here. So that would have been a lot of mail, but at least that way, a lot of those places like Kenwood, you know, a lot of people don't have Facebook or maybe just not paying attention to the news that much. They would have something that they could look at, have a phone number they can call, and maybe that might get those last speakers that we have. And also just letting the general populace know of how to get in contact with Cherokee Health Systems to get the vaccination numbers up. So just an idea, because I know we do a lot of mailers. I think everyone in my district receives a mailer when we got a new casino open, so I'm sure we could do it for vaccination. So that's just an idea. But appreciate it, Chair.
Thank you. Counselor Buzzard.
Yes, Dr. Jones, and you probably already got this covered, but I just want to ask or say something about the Cherokee Nation Home Health Program. I know it's not run by the Cherokee Nation, but do you correspond and work with those people through their program?
Yes, we have an open dialogue with them.
Okay.
Yes.
Because I know a lot of those nurses or LPNs, they do a lot of rural area reconnaissance, so there's a good connection there. But I thought you'd probably already done that. And I suppose with the PACE program is the same thing.
We've talked to them about being a part of our, what we're calling strike teams, that'll go out into the community and get those vaccinations done. So yes, we have had a dialogue with them.
Okay, Chief of Staff Enlow.
Thank you. So to Counselor Buzzard's question, we do work with both PACE and Home Health. We've assisted them with testing supplies, not only for their employees, but their participants as well. We've worked with them for early vaccination since they're part of the healthcare team. And so we do work with them on a regular basis of trying to make sure that we provide whatever assistance we can. And likewise, they can assist us to help get vaccinations out. And then to Counselor Nofire's comment or question, we have actually used all the applications that we received over the last several months, since we have good contact information for a lot of those citizens. We've been trying to use their email addresses for those that supplied email addresses so we can communicate to them. And we, to your very point, we are looking at sending out a mailer in the coming days to alert the rest of the world that may not have seen it somewhere else. So we're trying to hit everybody at every common denominator that we possibly can of communication through social media, phones, emails, text messages, and of course, newspapers and printed media through the mail. So we're looking at all of those. Thank you.
Very good, thank you. Is there any other questions anyone would like to ask? Are there, excuse me. Okay, Dr. Jones, I have a request. Is it possible in the future we could get the top 3 to 5 diagnoses from each clinic in our material that you present? I'd appreciate that.
Yeah, sure. We took that off and added the testing when it was so relevant, and I think they've added the vaccines now, but we can rotate that through, yes.
Very good. Listen, excellent report, and that's really exciting news for our cardiology and our stroke patients. I'm tickled to hear that. And that being said, I have no other questions, so thank you so much for your report.
Thank you.
Appreciate it. Okay, next up, we're going to have April Moore report on Cherokee Nation Home Health and Cherokee Nation Hospice. April, are you there?
This is actually Kristen. Hi.
Hi, Kristen.
Can you guys hear me okay?
Yes. Can everybody hear okay? Very good.
Okay.
Kristen, do you want to start off? Go ahead.
I will do that. You guys should have a copy of our report. Our home health census as of the end of February was 216. Hospice, we were at 20. Outreach, which is like personal care and those kind of things, is 727. We have 157 employees. 92 of those are Native American and 79 of those are Cherokee. To kind of touch on some things that Todd mentioned and Dr. Jones mentioned about partnership with them, we're very thankful to the Cherokee Nation. They have reached out to us and gotten us some testing supplies, so we're able to test our employees when needed. We've been able to test patients as needed as well. And we're doing that, anytime we've had like holidays, those kind of things, we've wanted to make sure that we get our staff tested so we're not putting anybody in the community at risk by sending out an employee that might be infected. We do have some PPE requirements, and Cherokee Nation has been really great at providing us with that PPE as we need it. Also, Speaker Enlow reached out during the ice storm to make sure that we had didn't have any needs for patients.
Excuse me, Kristen, could you set up a little closer to your microphone?
How
Thank
about
you.
now?
That's better, thank you.
Okay. Speaker Enlow reached out during the ice storm, so to ensure that if we had any patients that like needed a generator, make sure they had the supplies and things that we need. So we're really thankful for that. I don't have much else. Does anybody have any questions?
Yes, Counselor Vasquez.
Yes, hi, Kristen. I cover District 11, which is Craig and Nowata and Mays County, and I was wondering if you have any plans to offer services specifically in Craig and Nowata counties in the near future, and why we're not serving those areas now. Thank you.
So we currently have an office in Tahlequah, and then we also have an office in Salina. And in order to provide like good quality care for our patients and timely care, we stay within a 50-mile radius of both of those. So we do go into Mays. Right now, we don't have an office that would service those areas, though.
Can you find out if there are any plans to do so in the future and let me know?
Absolutely.
Thank you.
Yep, I can do that.
Counselor Taylor.
I'd like to know about the Grand Pad project that was in your report where you're offering the tablets to the elders, how that's going.
I do not think that that was part of our report. I'm not familiar with that.
Okay, my bad.
That's okay.
Okay, does anyone else have any questions? Kristen, that's a very good report. Thank you so much for being with us today.
Thank you.
Madam
Okay, and
Chair?
that brings us to PACE.
I
Oh,
was
I'm
gonna-
sorry, Counselor Enlow. Excuse me, Chief of Staff Enlow.
Easy. Well, since PACE is up next, I'll let them speak to that, but I was going to mention Counselor Taylor's question. The Grand Pads is something that we've been working with PACE and actually looking to see if we can't replicate that in other places, so I'll let them speak to that, but no worries.
Thank you. Okay, next up, Thelma Pittman with PACE.
Good afternoon. Can you hear me, Speaker?
Hi, Thelma. Yes, we hear you fine.
Okay, great. I sent a report early enough. I think you guys have that. Also included our newsletter along with our marketing plan for 2021. And we are using the Grand Pads. They are working wonderfully with our elders. They're able to communicate with each other. It's just really a good project where we have, I think, 45 to 50 right now. April 1, we should be getting another 51, and we should be able to have all of our elders covered by October. It takes a little bit to get them into the system. They have to do some training, and GrandPad is working with each one of our elders individually to train them on how to use the GrandPad.
Very good.
Right now, we have 186 participants. We are expecting April to have 6 more. We are increasing finally after COVID losses and the winter. Our team is really working to reach out and work with all of our elders that are non-native and native. We have 70 employees. 41 of those are Cherokee citizens. We have 6 others that are tribal, and the remaining 23 are non-native. Do I have any questions from anyone?
Anyone have any questions? I have a couple, Thelma. What percentage of your vendors are Tarot certified?
We have a real problem with that, Speaker, because most of our vendors are providers and hospitals and DMEs. I send a tarot report in each month, and it usually runs around 10% tarot, but of those tarot, 10%, we use 100% of those.
Okay, thank you for that information. And can you tell me how Cherokee Elder Care works within a nursing home?
our participants, we have several nursing homes that we utilize. And if one of our elders becomes a nursing home, they need to be in a nursing home, we put that participant in the nursing home, and we continue their care with our medical director and pay the fee for the nursing home. We follow state guidelines, and we are able to recoup a little bit of their Social Security or if their income to help, but we still provide all the services that are needed for that participant that's in the nursing home.
Okay, thank you so much. Anyone else with any questions? Thelma, I want to tell you, I've been here for almost going on 4 years, and I want you to know, you give the best reports. I just wanted to share that with you.
Well, thank you.
They're extensive and they're
Well, thank
very
you.
thorough, and thank you for that. That being said,
Also, I wanted to, I'm sorry, Speaker, I didn't mean to speak over you. Our financial audit is in, and it was unqualified. We had 14 years in a row, we've had non-qualified audits. So just wanted to let the council know that also.
okay, thank you so much. We'll let you go, and we just appreciate you. Thank you so much, Thelma. Okay. Is there any old business to discuss? Any new business? Okay, announcements. Our next meeting is tentatively scheduled for Monday, April 12th at 1 p.m. That being said, I'll take a motion to adjourn. All those in favor? Oh, thank you.